Welcome to the DNA of Things, where we explore how our potential is realized at the intersection of DNA, environment, and behavior. We dive into the science, technology, and innovation driving this transformational era. With expert guests, we uncover the ways these factors shape health, performance, and well-being. Now, today we're joined by David Lefkovits, CEO of Wellpro.ai, an AI-powered health tech company that optimizes the clinical workflow for functional and integrative medicine practitioners. David is a serial entrepreneur with expertise in enterprise, AI, and a focus on how emerging technologies can enhance personalized medicine. In this episode, David shares his journey into health technology and how Wellpro.ai is transforming medical practices. We start with his own discovery of inefficiencies in personalized medicine, and we dive into the cutting edge use of AI in optimizing clinical workflows. And we end with looking at the future of healthcare. This conversation is a must for a practitioner or practitioners and innovators who want to learn about the power of AI in healthcare and how it will shape patient care and outcomes. Let's dive in. David Lefkovits is a leading figure in AI-driven health technologies and enterprise innovation. He's a co-founder and CEO of Wellpro.ai, a company that harnesses artificial intelligence to empower functional and integrative medicine practitioners with precision diagnostic tools. Lefkovits also contributes thought leadership on enterprise AI, discussing how technologies like natural language processing, or NLP, and cognitive search can enhance human decision making and workflow in various sectors, including healthcare. So, welcome to the show, David. Great to have you.
Thank you for having me.
Yeah, my pleasure. So I've had the benefit of speaking to you a couple of times, and I've got a sense of, well, more than a sense. Actually, I've been able to experience by demonstration the Wellpro.ai solution, where, effectively there are so many points for, let's just say optimization on the care path. So from intake to delivery of care, and you supporting various clinicians at these various stages is no small feat. So I want to dive into how you're bringing probably a systems approach and AI to that solution. But before we dive in, I'm really interested to learn about how you developed this professional expertise and aura about yourself. So if you could, for the benefit of me, for the benefit of our users, just share how you got to where you are as the co-founder and CEO of Wellpro.
Sure, absolutely. So this is my fourth company. A previous one was completely unrelated. This is my first time in health tech, even though I'm married to a physician, an internist, and I've been around doctors and entrepreneurs. That's my world. But it's my first venture into the healthcare industry. So I'm coming at it from a very objective and non-jaded perspective. So my last company I exited early last year, completely unrelated. It was on-demand manufacturing. And so I wanted to figure out what I was going to do next. And I knew it had to be involved with generative AI and the transformational side of AI. AI is a term that's so hyped and overly used. AI has been around since the 50s. An algorithm is AI, right? Mm-hmm. And so, but there's a few components that are really, really made a big difference. One of them is the ability we have now to converse in natural language with our data. Mm-hmm. So rather than having to query a database with SQL or specific language or very methodical query mechanisms, we could just talk to the data. And large language models enable that data to be contextualized. So it can provide responses that are also contextualized. The other big component that's related is the ability to take unstructured data and convert it into structured output and access that unstructured data. So let me give you an example of what unstructured data is. Medical notes, in the case of healthcare, in legal, just any document that's not been put in a database, a PDF, an image of a document. And so now we have the ability really to take all this unstructured data, contextualize it, and converted and turned into structured output. So that's pretty significant. And of course, healthcare is full of unstructured data, right? There's a lot of data. There's a lot of documents that have not been integrated into the system. There's a lot of interoperability issues. And so what I did when I exited this company, I wanted to really focus on the transformational side of AI. And I took about 6-7 months where I spent my days, weekends, nights. I mean, I was obsessed and going into rabbit holes, just trying to understand the technology behind AI, generative AI and natural language processing and these language models and all these techniques that have evolved almost on a day-to-day basis at this point. Retrieval augmented generation, all these different features and capabilities. And so that gave me enough context to really understand how I could utilize these emerging technologies to drive value in workflows. And my thing has always been looking at a workflow and optimizing it. And essentially that's what AI is trying to do, is taking you from A to Z faster, quicker, more effectively. And so I started looking at a couple concepts in healthcare. Initially, it was trying to find a solution to augment a physician's workflow, more specifically my wife, who, even though she's now works just 3.5 days a week seeing patients, she's constantly on her charts, evenings, weekends, vacations. There's a lot to it. And for the first time, we were on a trip. We were on the beach early last year, and I was curious to see what she did in her charts. And so she gave me an overview. I was pretty amazed at what a cluster that was, and I had a whole different level of respect for it. And that's kind of how it started.
Amazing. So a very kind of personal encounter with the problem as it is. So that's really what happened in the last 7 months, let's call it a year, following your previous exit. But what about before the 4 companies? What's your, professional training or, was it typical? Was it atypical? Because like while AI, everybody's talking about it today, there are very few people who really understand it. So I'm curious to know, what your professional path was that led you into this space.
Sure. And I don't think it's the path as much as it is curiosity, interest, excitement for the new. And by the way, I'll just say this is the first time in my professional career I've been able to join an industry from the inset, as opposed to always participating in mature industries. You just had to come with a differentiated business model or a better way of doing things. So this is very exciting. But my background, I'm originally South American. I grew up in Venezuela, came to the States for college, studied industrial engineering. And I had a very short stint in the corporate world, software, supply chain software. Eventually, our company was acquired. I moved to Holland for 5 years, where I managed our European Asia Pacific businesses. That was in my mid-20s. And so my background is as a technologist. Even though I was in the business side of things, I've been deep rooted into technology. And then following that, I began my entrepreneurial life. I started in real estate, development, construction, and then I got into financial services and a few other things. And ultimately, I've done e-commerce projects, as I mentioned, on-demand manufacturing. And the one common denominator across all these businesses is always how to use technology to really augment workflows, process. And so that's a little the background, if you and I think also, having a global perspective. I've, living in South America, I spent the first few years working with the Latin American region, then Europe, Middle East, and Africa, and then Asia Pacific. It just broadens your horizons, and I think you see the world in a very different way.
Okay, yeah, that's great context. So, okay, Wellpro.ai. How long have you guys been around?
For about 10, almost 11 months now.
Yeah.
So we're still in the early days, as I would say.
I'd almost call you guys stealth. I check out your website, and it's well, we'll see as you start to reveal some of the things that you're doing and who you're doing things with. When we first met, we were talking about, I think one of the data sources to integrate DNA, in and amongst the electronic medical records and, providing context and personalization therein. And yeah, I was fascinated to learn your approach, frankly, to the business. You're very much building the product in market, in partnership with what I think we call, innovative partners. So I'd love to, learn as much as you can share, about the, kind of where you are now, the vision of where you would like to be, say, in the next, 3 years. But what are the current projects that are getting you there? And what's your ideal customer profile right now as it has presented itself to you?
Sure. And a lot of good questions to unpack. Yeah, let me start with maybe a segue to where we're at today with Wellpro. So I did transition from that primary care general
Yeah.
physician workflow augmentation to something a little bit more specific,
Right.
into the, it's there's so many definitions for this. I'll call it personalized medicine
Mm-hmm.
or precision medicine, which really encompasses integrative medicine, functional, longevity, root cause medicine, P4, as some people call it, and all these different fields that really look at the root cause as opposed to addressing the symptoms. And in order to do so, they apply the systems biology approach of looking at the person as a whole, as opposed to individualized components or body systems.
Right.
And so obviously that's a lot more complex in many ways, because you need to understand a lot more of the human body. And typically it also incorporates many more data points in diagnostics. And that's where we began the conversations and how we could use genomics and DNA analysis for disease dispositions, understanding the potential of your DNA and the way your genes are expressed. And I think we segued into epigenetics and DNA methylation. There's a lot to it. But beyond that, there's the biome, which we know very little about, but there's lots of testing. There's hormonal testing. There's neurofeedback. There's breath analysis for metabolic function, blood tests, urine tests, feces tests. It's a nutrition evaluation. There's all these tests and diagnostics and data points that really it's almost impossible for any human brain to be able to internalize all of that and contextualize it. And so that's at the premise. And also this world is interesting because, in traditional allopathic medicine, you go to medical school, that's where you derive protocols that you apply in medical school.
Mm-hmm.
And in this world of personalized medicine, I would say to a certain degree, it's almost the Wild West, where a lot of different people are doing their own protocols based on anecdotal, based on evidence-based, based on whatever it is that they base these protocols on. And there are many traditional allopathic practitioners that are moving to this space. They're extending beyond conventional medicine, adopting Eastern therapies, but also looking at this systems biology approach to healthcare. And so it was a very interesting use case. And I believe that the future of medicine is personalized medicine, where practitioners will deliver a personalized, holistic, and data-driven care.
Mm-hmm.
Some of that has to do with genomics, but it also has to do with being able to understand all the aspects of your history, of your current health, and your wellness goals and health goals. And so that's a lot to take in. And that layered on top of just a very, very inefficient workflow for clinicians, where I think because of the bureaucracy of insurance and privacy and compliance regulations, there's a lot of things that need to be done. Some that are necessary and some that are more on the administrative bureaucratic side. And so it's a lot of heavy lifting now to practice medicine. So what we're trying to do is to augment that process. And I use the term augmentation as opposed to automation because, I don't think AI in many ways is designed or ever will replace a healthcare provider. I think it's a turbocharge for them. So it helps them, instead of having to go into 5 different places to look up information and open a bunch of PDF files and read inside through, filter through all the data to try to obtain and extract notes, we can summarize all that into a format where they can get what they need. We can provide chatbots where they can interact with the data, ask specific questions, and just really augment that front end piece. And then there's all these capabilities today to listen to patient encounters through what we call, clinical intelligence, which is what most people know as AI scribes that can extract the data, generate soap notes, and then ultimately directionally and from a guidance perspective, put all this together, identify potential contraindications, suggested treatment plans, and that need to be reviewed, of course, by the practitioner. And once reviewed and edited, it just simplifies the process of putting it in a context that you can quickly and easily send to your patient as an explanation letter. And so that's at a high level the clinical workflow. And then on the fringes of that, there's a lot of other features and that enhance just that overall.
I listened to you, talk through all of the different data sources available, how diverse they are in terms of, well, let's even specialty and subspecialty. And, but we've always kind of been striving towards this integrated medicine or functional medicine or holistic medicine. But I've never heard the problem described so, let's just say, meticulously as you have just done it. And it makes me wonder how we've been doing, medicine at all with all of these, potentially contradictory inputs that aren't necessarily being considered in context. So I'm interested to learn what the physician reactions are to this solution that you're putting forward, because like I'm hearing it and I'm like, wow, I think you just saved me 10,000 hours. And then, okay, so then the other side of that is, well, you've just robbed me of 10,000 hours of learning, using that whole,
Yeah.
So, and I don't believe that's true. I'm just being facetious. Like,
No, of course.
now you have more time to spend on learning other things. So what are the practitioners saying to this kind of solution?
Well, there's the traditional practitioners, which my wife is one of them.
Yeah.
And let's start with the fact that there's a lot of very, really good practitioners out there in this functional, integrative, holistic longevity space.
Of course.
There's also a lot of hokey pokey.
Yeah.
Going on. And so how do you differentiate between the two? And in fact, maybe some of the hokey pokey folks are not as out there as one would think. No, we're not developing a platform that's going to dictate protocols,
right,
or come up with science. We're developing a vehicle to be able to ingest all this information and make sense out of it in a more productive way. And so I think, to your point, there's a few things. One is, practitioners are known for not having, maybe even not enough time for their own families. So imagine expecting them to go out there and, they've got ongoing credits that they need to go to maybe once a year. But let's just look at the basic premise as to why traditional medicine has been so slow to advance. And it all stems from the curriculum. For example, medical school is dictated by 19 individuals who are the board members of the WAMC.
Wow.
And so every day there's hundreds, if not thousands or dozens of thousands of new literature, new reports, new research, new findings. How is all that filtered into the medical curriculum? How is all that communicated to practitioners? They've got to read their journals. They talk amongst themselves. It's a very inefficient way of advancing medicine at scale for all practitioners. And so that's why many times it takes so much time for this to seep over, and only just a little bit of it does. And yet we have this whole repository of data. A lot of it is evidence-based, some of it isn't. But if you just focus your clinical biomedical model on literature, evidence-based, the genuine stuff that's out there, there's a lot of information you can tap into. And I think we would all recognize there's no one individual that has the ability or capacity to know it all or even close to that. So you really need a significantly more sophisticated compute to be able to rationalize all that information. So in a way, it's a way to be able to democratize access to all this wealth of information to the practitioner.
is interesting where you said there's functional med or integrated med docs who are really good. And then you said there are others that are kind of, I can't remember the word you said, out there or
Hokey pokey.
hokey pokey. That was, that was the word. I'm, working with on a project submission to DARPA. So the Defense Advanced Research Projects Agency. And there's a subsection in that application that talks about one of the, I think, 5 areas that they're focused on is prediction and health, right? And so prediction, within prediction and health, essentially what they're looking for is help with developing transformational tools that improve health outcomes through early exposure risk models, predictive disease assessments, and I like this part, personalized counterfactual prediction and explanation based on fine-grained individual data. I mean, that's really amazing, right? It's just the language is it's not even counterintuitive. It's counterfactual.
Well, I don't know if it's, counterfactual may be the term. Maybe another term is counterintuitive.
Right, yeah.
There's all these relationships in our body, and by no means am I an expert. In fact, a lot of this knowledge I've been acquiring recently through a lot of reading, a lot of podcasts, and just being involved in day-to-day with practitioners. But I mean, if you just look at the relationship between the brain and your microbiome, and so something that may be mood related may have something to do with your gut, and so these are in many cases very disconnected systems to many, right? And it takes traditionally different levels of expertise to connect the dots. So I would say, I don't know if that's what they were referring to there, but it sounds to me like that could be potentially, one of the topics that they're discussing. But I wanted to go back to one of the questions you asked that I think was very important.
Sure.
That I didn't get a chance to answer or provide my perspective rather, because, not dealing with absolutes, this is my fresh perspective on things. How do practitioners, how have they been able to practice medicine so far? And I will say that we've seen an evolution, because before EMR systems, practitioners had a lot more time with their patients. They had a lot more time to evaluate and study their patients' charts. The economics were very different as well. And today it's very hindering, very difficult. And that's one of the biggest frustrations practitioners have, especially those that went into medicine to make a difference and to help people, when they're extremely limited in how much time they can allocate to each patient, right? Maybe 10, 15 minutes max. They can't get to the bottom of things. And if they don't have a lot of time in the front end to review and learn and understand and internalize their patient's charts. And then they have very limited time to deliver nations, and if so, they have to really prioritize on 1 or 2 items that are the most important, and then go from there. And at the end of the day, and this is a whole different tangent, but one of the systematic barriers I think in healthcare today is, and this is no surprise, I mean, we're in a capitalistic society, and health is a business. I mean, we may not want to acknowledge that, but that's the reality that we live in. And I don't see socializing medicine anytime soon. So really, it's a matter of how do you align the key components to make this work. And the key components are quality of health, quality of outcomes, the cost of delivering that health, and profits. And so this is where I think some of the emerging technology can really help drive and increase the quality of care and lower costs. And so, this is one of many systemic barriers. I mean, there are many others that have to do with the payers and the food industry and the drug industry. I mean, there's a lot of barriers that make the disrupting of healthcare very challenging. But we're going about it from the technology side in a very specific niche area.
Right. And in a very creative way. So like you're building the product in market. So, I mean, what's that like? It's like, effectively, it seems to me historically you'd call them customer, but it's almost more like innovation partner that you bring on board. It's almost like you're gaining a team member and benefiting from that subject matter expertise. So it's a really, fascinating way to build a product. What's that been like for you?
Well, it's been an evolution. I mean, to arrive at this place, and even though it's only been 10 months, I mean, we've moved pretty quickly. But I think phase 1 is you identify a problem, a pain point, challenges that need to be solved. in my case, it's not a story of, my parent had this and that and the other, or I went through a really bad healthcare experience, and that's what made me want to focus on this. As I said before, I'm very much a process guy. And so I had an experience at a functional medicine practice, just, finding ways to optimize my health. And I really liked the concept of what they were doing, but I thought that the whole workflow was very inefficient, very broken, very segmented, and not really cohesive. And that's sort of where the idea became, well, I see all these different variables are different from traditional medicine, and most of them, which are the same actually. And so one of the reasons I didn't continue pursuing traditional allopathic medicine or the traditional healthcare system initially is, as I also said, it's very bureaucratic and barriers to entry are very high. And so it's really hard even connecting with these large EMR systems like the Epics, Cerner's, the Athenas, Allscripts. And so this was an opportunity to do sort of, let's call it our MVP, if you will, in an area that's really leading the way to personalized medicine. And I truly, again, think that over the years, we'll see how healthcare is going to be going in that direction as technology evolves, but also as people's expectations change and their ideas of what a good healthcare experience is. Not so much, is the reception nice? Is the receptionist nice to me? Did the doctor have a good bedside manner? And did they get back to me quickly? But beyond that, which is important, it's patient experience, are my health outcomes, have they been modified? Have they changed for the better? Have I gotten the right intervention plans to really make a difference? And have I been afforded tools to really help me engage in the process? And because at the end of the day, compliance is key. If you don't comply with your plan, nobody can do it for you. So there's a lot of elements to in making sure that this is delivered effectively.
Mm-hmm. Mm-hmm. I wonder, how far away are you to those patient outcomes?
Well, actually, and I think I stopped mid-sentence there because the question was, how have I arrived at where we are today? So the initial phase is really hypothetical. Mm-hmm. You have a hypothesis of what folks need. You go out there, you talk to as many practitioners as you can, to as many diagnostic experts as you can, as many thought leaders as you can. You try to understand what are their hindrances, what are their challenges, what are their pain points, really how this whole world works. And you start puzzling an overall workflow. And so initially you have a vision of where you want to be, but it's very hard, especially these days, to just share a vision. I think being able to represent it in a more visual, tangential manner is important. So, we developed what you call an MVP, which is very typical in a startup. An MVP is referred to as a minimum viable product, which is sort of an emulation of what the workflow would look like, or what the tool would look like. You can simulate the inputs coming in. In our case, it was beyond simulating. It's the functionality is live. And we happen to put a lot of effort into our MVP. It's 4,000 hours. So if you recall, our MVP really looks like a full-blown platform, right? And believe it or not, we still have a long ways to go adding layers and features and capabilities, because it's a whole ecosystem of sorts to achieve this seamless workflow. So once we had an MVP in place, the next logical step is you want to have users trying it out and testing it. And so we were promoting and trying to recruit pilot users, which are folks that are interested in the concept and they're willing to give it a spin and a try. But going back to our earlier point, practitioners are very busy. Mm-hmm. Mm-hmm. It's very hard to get them to commit time and effort to consistent cadence of meetings, to going through the work of providing feedback and reviewing their workflows and, doing all the necessary stuff to really build a solid product. And I was not interested in continuing to build something speculatively, but we wanted to make sure that our users' roadmap became our roadmap. And so for a couple of months, it was very challenging because, of course, everybody that we spoke to was super intrigued and super interested. When they saw the demo, they were pretty amazed at some of these capabilities. But when push came to shove and they needed to allocate time and resource and efforts, life happens. Other day-to-day fires happen, other priorities arise. And so that's where, it evolved more into a concept of we call co-development. A co-development partner is one that, and this is what I found to be the ideal one for us, is one that already had this vision and was already trying to pursue that vision, either by going out and trying to find solutions to this specifically, or even going out to developers and getting proposals on getting this developed. And of course, part of the challenge is there's not a whole lot of people that know how to build this, given the technology is so recent, but also very costly. I mean, a couple of our co-development partners were getting quotes for a few $1 million to do something that was going to be a subset of what we're working on right now. And so it just did not make a lot of sense. And so part of the co-development partnership is also they are committed, but they have skin in the game. So they're paying us up front for a year worth of services. And so I would say that authentic demand is when somebody's willing to pay for your services or your product, even though it's not fully built. And that's the only way to make sure there's skin in the game and there's commitment to proceed. And we're also allowing our partners, and I'm not trying to sound modest in terms of allowing, but we're very careful in raising funds too early, so that we're not focused right now is building a great product. But nothing would make me more happier than having our customers on our cap table. And so they have the option to be able to invest at much lower valuations right now. And so we're trying to align our incentives and our end goals. And so now we have two really, really good co-development partners that are practicing very well. And I'll just say that not everybody that preaches integrative functional medicine or longevity medicine or holistic medicine are actually delivering it, because it takes a lot of time to study your patient, a lot of time in the back end to dedicate to them. Many are just doing the whole battery of tests. They're charging the big bucks, but ultimately they're not delivering personalized outcomes. And they're just sort of trying to expedite through the process without, crossing their T's and dotting their I's. It doesn't mean that they're not practicing proper medicine. It means that they're practicing a very limited part of the scope that they're promising. And it's understandable, because they've got to make their numbers work. This is their livelihood, and they don't have the tools or the capabilities to spend more time on delivering that care.
And so these two innovation or co-development partners that you're working with, what's the size of their patient roster?
So I'll share more in terms of their configuration.
Sure.
One of them is a practice with 3 locations, opening up their 4th, and their 4th is out of state. They probably have a combined staff of about 60.
Okay.
They've got a few medical doctors. To a significant extent, their critical mass is with physician assistants and nurse practitioners, which I've got to tell you, I'm very impressed with a lot of these MPs and PAs. And in many ways, they're as good, and in some cases even better than the MDs, because they're in the nitty-gritty of things. Also very well trained. And there's a lot of different organizations out there that are emerging that do certifications around this holistic or integrative medicine models. And so for them, one of the key challenges and opportunities too with something like this transcends just optimizing the clinical workflow. But imagine now you're growing and you're adding new locations, and there's always churn with your own people, right? Or as your individual practice grows, you want to add more providers. You need to train them. There's very few people that are coming into your practice that already have this extensive background.
Right.
And even if they do have a broader background, they may not practice medicine within the guidelines or styles that you're bringing to your patient base, right? Because you need to systematize to a certain degree how you deliver care, how you create guardrails so there's consistency in that quality of care. And so imagine the training that's necessary. So one of our partners, it takes them approximately 3 months to train somebody, and almost a year to get them to the point where they feel comfortable that they can be autonomous. So imagine having the main knowledge base, almost like a 24/7 mentor that can guide them, that can also guide them in terms of the protocols of this specific practice. So, one of the key things of our platform is that you can upload your own protocols, your own domain knowledge bases that stay separate from the larger clinical biomedical model. It's only contextualized for your practice, and it provides guidelines and direction. Plus, you're able to contextualize the overall wealth of medical information with the specifics of your patient's data. So, it's also a significant augmentation tool for onboarding new people and maintaining that systematized, more consistent approach.
Amazing. So so you have the global access, or let's call it local global. So let's say the local knowledge base. You have access to that as a new practitioner. It doesn't mean necessarily new just out of school. It could be new to the clinic and bringing 20 years of expertise. And say your expertise is focusing on postmenopausal women, versus a clinic that's been focused on 40-year-old men at risk for heart disease. Yeah. Okay. So that's amazing. So do you think, or have you thought about like even further up the chain? So when these practitioners are still, in training, so when they're still doing their professional degrees, is there a future, where, systems biology essentially is discussed in confluence with the technology, right? So there's a lot of abstraction about, why this is good, but then, the execution requires, I think, the technologies that are available, that are possible, but are perhaps not practicable yet. So is there a stage where you guys see yourselves as, partnering with professional schools for education? Is that a, path to your, kind of channel growth and development, or maybe that's too early to say?
Well, there's a lot to the vision of where we can be and where we can arrive at. I mean, if you look at Epic, which is probably the largest medical IT company in the world, right? I mean, I think last I heard 80 billion a year, or 80 billion market cap, a private company. Year one, they were a basic platform, right? And they started layering and adding in. But I think we're starting at the right point, and I think our vision is the right place. Now, the key is everything in between, the execution, the path. Where do we focus on first, and what do we phase out over time? I think in general, technology is going to be a key part of delivering education. I mean, not only healthcare, but across the board. But just think of this. Do we want our medical students spending hours memorizing body parts, or learning how to use technology where they can, in a quick question, get all those answers right away, and focusing more time on understanding, for example, nutrition, and how nutrition can be used as medicine, or even epigenetics or genomics, which the science is changing so quickly. And by the way, that's one of the biggest challenges diagnostic labs have with their reports, is the amount of resources it takes them to train their professional services clients and support them when they receive these diagnostic tests, in terms of interpreting them and translating them into actionable insights, right? And you probably, as well, this is your world. You've seen these 10, 20-page reports, sometimes longer, for one report, and then you consolidate 4 or 5, and now you're talking about packets of 80, 100 pages. And so that's a lot to consume and make sense of.
Yeah.
So maybe to answer your question, I mean, our long-term vision is to create a platform, an AI native platform, that where you're able to deliver care, and all the data that's within that system is contextual. And we have the vision of a language model that's personalized for each individual, that is trained along the journey, and so it understands and learns all of an individual's health history. So at any point in time in all their tests, and so at any point in time, any given practitioner can tap into that and derive the right information that they need, or contextualize that data with what their objectives. So that's a core piece of that. But also, you mentioned something interesting, because part of our vision too is having a marketplace where, if you're the Institute of Functional Medicine or the AMA, right, and you want your curriculum to be delivered, that this can be part of the marketplace where you're delivering a turnkey system that's trained by the AMA curriculum, or trained by the Institute of Functional Medicine curriculum, where the protocols are provided. Or in the case of folks like Huberman or Peter Attia, or all these well-known, Mark Hyman, or Brian Johnson, the Don't Die guy, right? With his blueprint, that they can have their protocols on the marketplace. And if you're a practice and you want to adopt certain protocols, you can just connect to them and they could be used in order to take the inputs and generate outputs. So in the context of a marketplace where you can leverage that information, or where institutions can deliver a turnkey solution that is not only the knowledge or the curriculum, but also being able to connect that curriculum with specific outputs, that's of course part of our vision as well.
Do you think, going back to one of the things you said about how curriculums were designed, like medical school curriculums, for example, I think you said it was like a board of 19 individuals. Is that what you said? 13, 19?
19. Yeah.
19, yeah. And now you're talking about a marketplace of probably evidence-based practice, right? And it is, I always did find that interesting, right? It's like you get your medical degree and then you go and you practice medicine, right? And you're always practicing medicine. You're never finishing, which, I mean, it's true of professional athletes too, right? So you're always practicing. Do you imagine that having a marketplace and then even having another layer of, analytics, like call it like meta data analysis of the marketplace, do you see that as like, a way to accelerate, leaps and bounds into, let's just say, like knowledge feedback, right, from this evidence-based system, and so therefore, instead of 19 individuals, maybe you have 19,000 or 19 million, or heck, maybe one day, billions of health records that actually support the direction now that medicine ought to go. So have you thought about how a marketplace such as yours, even if it's only abstractly, could actually serve not just the practitioners, but the industry as a whole, where, you're communicating the positive results, but then there's also, the journal of negative results that nobody really wants to publish in.
Yeah. Okay. So I see where you're coming from. And by the way, I'm not trying to oversimplify how the AAMA comes up with their curriculums, because I'm sure it's more than just, but at the high level, it's 19 board members that dictate the fate of the curriculum. And again, I'm not familiar enough with the details as to how, I'm sure there's plenty of collaboration from many others that contribute. But the fact is that there's significantly, exponentially more new findings and new science and new literature and new papers are coming out every day, and the ability to absorb these into and then regurgitate them back to the medical community in an efficient way. So what you were describing before really is what large language models do. Is they're deriving all their learning from all of this data out there, all the papers. I mean, everything's in PubMed, everything's in IHC, all this information. But you brought an interesting point, which is, and the best way I can answer that, which is slightly correlated, but not entirely, because I don't have a specific answer to how can you then incorporate back into the loop the negative findings, right? Or those things that were invalidated, which is, I think, what your question was. How do you streamline that knowledge base to separate what's accurate and what's not? And I don't know if this is black and white like that, what's accurate and what's not, because it could be accurate for certain instances and not for others. And that's what makes it so complex. But I can tell you, in talking to one of the leading diagnostic labs out there that do epigenetics, one of the things that they were very interested in is if we can provide you guys with DNA methylation data, and you guys are collecting all this other data, unidentified, if you can send back that data and how it correlates to sex, body, weight, height, basic markers like A1C and glucose levels, testosterone, and all this other, that helps optimize the algorithms to make DNA methylation a lot more effective. Now, there's issues with privacy and our ability to even if it's unidentified data, to bring that data back. But that's just an idea of enriching, augmenting the data by taking a set and adding context to it. And so, and I think there's a lot of groups a lot of companies out there that are doing that are trading in data, that are trying to manage and ingest data and enriching it so that it can serve that purpose that you're describing. But that's a little bit outside of the scope of what our vision is now. It's less about developing the science or the content and more about enabling the delivery of the content and streamlining the workflow. Right. So if you will, we're sort of the black box. There's folks out there that are working hard on foundation models for AI. That's not us. They're developing the models that we're using. There are folks out there that are working on the data science, that are working on the protocols. That's not us. What we're doing is, what's commonly referred in the industry as applied AI, which is developing a workflow around all this technology. Now, in what we're doing, there happens to be quite a few things that are more complicated and are proprietary, not in the medical science side, but in the execution of the code in order to achieve certain things, in the way we've architected the solution. So that's the area where we play in, is facilitating. And as they say, garbage in, garbage out. So if you're a practitioner that has really bad protocols, and we're augmenting your process, but we're augmenting it consistent with your inputs, right? And of course, it doesn't only look at those protocols; it also looks at general medical information too. So there's, guardrails around that.
Got it. Well, hey, if I'm a practitioner and I'm listening, I'm thinking, like, how do I get in touch with David and the team at how do folks get in touch with you? I know you guys are on LinkedIn. I know you guys have a web page, but how do people contact you at Wellpro typically?
Sure. I mean, and as you mentioned before, we're really not in stealth mode, and I'm happy to open up and discuss anything. It so happens that our website is really one landing page.
Yeah.
At this point, we put minimal effort into the website. We put more effort into our LinkedIn page and the articles that we come out and building the relationship with the influencers in the industry. But more importantly is our entire focus is around product building. So I'm always happy to talk to anybody on this topic. It's exciting. It's educational for me too, because every time I speak to somebody new, I learn a lot. But if anybody's interested, they can just email me directly at david@wellpro.ai, and we can set up a time. For those that are really, really interested in potentially being a co-development partner, we certainly talk about that as well. I think we're going to be at a commercial stage probably about 6 months from now, probably beta in 4 to 5 months from now, and maybe commercial 6-7 months from now. But again, our focus here, even though we want to move very quickly, is to build an amazing platform that really adds value. And so that's more important than anything else at this point.
Amazing. I don't know if you saw one of the things I list at the top of my kind of description of the podcast was, kind of the intention. So there were 3 questions I just wanted to kind of wrap with. So number one is, if this was your last podcast, who are we talking to? What do we want to say? How do we concisely summarize what we just discussed? And who needs to hear that message most? That's number 2. And then the last question is, who would you nominate if you could choose anybody to be a guest on the DNA of Things?
So on the first point, now I realize that it has to be related directly to this topic. Right? So listen, I think ultimately all this technology is going to catch up with people. People are going to catch up with this technology. It's just new now and everybody's trying to figure it out. But, if we just look 2, 3, 4 years from now, it'll be kind of day-to-day lives, right? And it's starting to blend in more and more. And I think hopefully what I shared may resonate a little bit more with innovators or potential entrepreneurs that have an idea and want to bring it out to market. It's hard, and there's lots of barriers, and there's always challenges. And so just as I described, I wanted to go into the traditional healthcare world, and that seemed to be really difficult. It's how do you go around and how do you figure out ways to, I think somebody called it a Trojan horse. What is your Trojan horse to penetrate the market? And that's probably one of the hardest things to do is that taking the company from 0 to 1, which means now having an operational product that's adding value with paying clients, et cetera.
Mm-hmm.
Then taking it from 1 to 10 or 10 to 100, that's a whole different set of skills. But I didn't have much background in healthcare. I do have somewhat of a technologist background. I mean, I'm technical. I'm not a developer myself.
Mm-hmm.
It was more the concept, the idea, and bringing that to life is just. So I guess those are the ones that I would want to inspire others to bite the bullet. And if this is something you really want, it's difficult, it's hard, there's no right answers, it's ups and downs, but
right.
it's an evolution.
Right. So this is the future is coming. The future is arguably here, I think, is what you're saying. And, I think in terms of who we need to embrace it is the practitioners, but I suppose the end users, the patients are going to want this maybe when they get over the idea of, AI not being so scary, if that's.
Yeah. Well, I think that, our tool or our platform is a B2B platform.
Yeah.
It's for practitioners, not for the end. And even though we do have a patient portal component that we're going to expand over time, and one of those components is being able to take a lab, upload it into your system, and be able to create a vulgarization, an explanation of that lab in layman terms that you can then send to your patient. They can see the metrics, but that they also have a chat where they can ask questions about their lab or that lab contextually to all their patient history. And that would probably cover 85% of most questions. Of course, sometimes so I think that's just as people get more used to using ChatGPT or Copilot with Microsoft, it's going to be less of a weird thing,
right,
and more normalized.
Right.
And it's just a matter of time before we get to that normalization. The same thing with practitioners, right? Now it may exert a lot of effort. It may still be skeptical, but at some point, we're all here today buying online. We've been doing that for many, many years. It was awkward and bizarre in 2000, 2001, 2002. Right? But it's pretty awkward not to buy something online today.
Right.
Right? Or groceries. Getting groceries delivered seemed like a really strange idea 10 years ago. And that's my wife. We go to Costco once a week. And other than that, everything comes delivered through, online. So it's a very exciting time. And I think healthcare is going through a major transformation. From a technology perspective, just the system itself is bursting at the seams. People want to change. Practitioners want to change. Patients want to change. The only ones that don't want to change are the pharma, the food industry, all of those groups that thrive with disease.
Great segue to the last question. Who would you nominate to be on the DNA of things?
Well, segueing from this topic, I mean, I think one of our practitioners would probably be a good idea, especially since they really practice medicine the right way. And they take their time and to get to know you, to understand all the intricacies, and they do dedicate that time. So I think they would be a good potential guest.
Well, hey, I'll once we get your podcast out, you can share with them, and I'll hit you up to see if we can get a practitioner visit. Those are actually always very insightful and enlightening here. Actually, I had a psychologist on just last week, and it's just really amazing how you're starting to see the intersection between the DNA, what we're born into this world with, the environment where things just naturally expressed by just say chance, and then kind of the behavior, kind of look at it as this Venn diagram, right? So that's a point where we can actually be actors to change our environment and change the habits which affect the expression, and even one day actually change our DNA with the inventions of gene editing technologies like CRISPR-Cas9. So it's a really exciting time to know ourselves and work with practitioners who are taking this kind of mosaic systems approach, and just absolutely fascinated and with the work you're doing, David, and delighted to be able to have you on the show and get your message out. Thank you so much for joining us.
Thank you so much for having me.
All right, what a fantastic discussion with David Lefkovits. If you're in healthcare or technology, I hope this conversation gave you new insights into how AI can revolutionize clinical practice. We explored how Wellpro.ai is streamlining complex workflows, allowing doctors to focus on patient care by harnessing the power of AI to sift through vast amounts of data. Imagine the freedom practitioners will have to dedicate to more time with patients, while technology ensures accuracy and efficiencies. This episode shows us that the future of healthcare is already here, and it's transforming how we deliver and receive care. If today's episode resonated with you, please share it with others. Today, we can push these ideas forward and make personalized medicine a reality for everyone. Thank you for tuning in, and stay curious.